Lymphedema is essentially a buildup of excess or too much lymphatic fluid because of damage to the lymphatic channels that drain this fluid. In the United States, the most common cause of lymphedema is damage to these lymphatic channels as a result of surgical treatment of cancer that's necessary to remove lymph nodes to prevent the spread of cancer. About 20 to 30% of patients that require this lymph node removal for treatment of cancer will develop lymphedema. The most common symptom of lymphedema is swelling of the affected area, swelling and pain actually of the affected area. Other common symptoms include achiness, heaviness of the affected region, abnormal sensations like pins and needles or shooting pains. Lymphedema can also make it easier for skin infections to set in, and in this situation, patients will have redness and swelling, sometimes fevers and flu-like symptoms. Lymphedema is generally a clinical diagnosis, and what that means is that we diagnose is based on the symptoms like swelling and pain that patients present with. To confirm the diagnosis and plan for surgery, there are other tests that we can do. The most common of this is called lymphangiography. And in this test, we inject a dye underneath the skin and look under a special light to see how well the lymphatic system is working. So this helps us confirm diagnosis and can also help us plan for surgery. There are generally two ways lymphedema is treated, non-surgically and surgically. Treatment generally begins with non-surgical treatment, and what that entails is physical therapy to decrease the swelling, therapy to make sure that the joints of the shoulder, the elbow, the hands don't get stiff, and skincare to prevent infections from happening. This treatment works for some people, and they don't need anything else. But for those that don't get enough symptom relief from physical therapy, we consider surgical treatment. And the surgical treatments in general are based on either fixing the lymphatic system to drain the excess fluid or removing the damaged tissue that has resulted from lymphedema. In general, the two different paths, surgical paths for treating lymphedema are: one, fixing the lymphatic system, or two, removing the damaged tissue that results from lymphedema. For fixing the lymphatic system, there are two ways we can do this. One is to connect the lymphatic system to the venous system to help drain the excess fluid that has accumulated as a result of lymphedema. The other method is to harvest functioning lymph nodes from one part of the body and transfer them to the part of the body that's affected by lymphedema to also fix the drainage system. On the other hand, if the lymphedema has progressed to the point where fixing the lymphatic system is not going to work, the focus is on removing the damaged tissue from lymphedema to provide relief, to provide symptom relief for patients. The recovery from lymphedema surgery differs based on what kind of surgery patients get. Generally, for patients that get operations that remove the damaged tissue from lymphedema, recovery is a little bit more involved because it involves more extensive wound care, and it involves more extensive care of the surgical site in terms of the fact that patients have to do wraps to keep the swelling down, and this can keep them from getting back to their activities of daily living for longer. For patients that undergo operations to fix the system, like the venous bypasses or the lymph node transfers, recovery is generally quicker. In fact, for the bypass operations, it's day surgery. Patients come in and leave the same day of the operation, and they can generally get back to their activities of daily living within a few days. For the lymph node transfers, it requires a short hospitalization because we need to make sure that the transfer tissue is alive and working where we transferred it to. But after the patient leaves the hospital, the time to return to activities of daily living is usually within a few days. The reason to come to Johns Hopkins for treatment of lymphedema is that we have a very comprehensive program that ensures that we tailor treatment to patients specific to their needs. We understand that not everybody is going to be a surgical candidate, and we have a therapy program that takes care of those patients. And for patients that do require surgical care, we have a broad range of expertise to attend to those patients' needs.